So let's go ahead and start this. So basically, whenever you're looking at an antibiotic, right? What do we use antibiotics for? Do we use them for, can you use an antibiotic on a virus?
No,
Can you use it on a fungus?
no.
Good. So the only thing that you can use an antibiotic for is a what?
For infections?
Well, you could have a fungal infection or a
Yeah.
viral infection.
For eliminate bacteria?
There you go. Bacterial infections, right?
Yes.
And so if you want to target or kill that bacteria, then you have to work on what's protecting the bacteria, right?
Yes.
So what protects the bacteria is a cell wall. So one of the ways that you can kill the bacteria is to target or attack the cell wall, okay?
Okay.
There are certain bacteria that, antibiotics that work by attacking the cell wall. So basically, I'm going to circle the most important ones. Penicillins, cephalosporins, vancomycin. All right, these are the big three that attack the cell wall, okay?
Okay.
For the most part, on your exam, they're going to either ask you about penicillin or cephalosporins. For if they talk about cell wall inhibitors. So cell wall inhibitors is a mechanism of action.
Mm-hmm.
So if I were to ask you, okay, how does amoxicillin work? What would you tell me?
It's killing the bacteria because it's killing the bacteria because it's the mechanism of action of the amoxicillin is kill the cell walls in the inhibitors.
In the what? In the what? I didn't hear the last part.
Okay, is killing the bacteria because the mechanism of the antibiotic is killing the cell walls.
Very good. It's a cell wall inhibitor.
Yes.
Right, exactly. Now that cell wall is made up of a structure called peptidoglycan.
Like, okay.
That's the cell wall. So whenever you look at the bacteria,
Mm-hmm.
that wall that's around that bacteria, we call it a peptidoglycan wall.
Yeah.
And so the antibiotic, it will go and it will inhibit the formation or it would inhibit. So before that cell wall can really form, the bacteria, the antibiotic is going to inhibit that.
Okay. Mm-hmm.
Got it?
Yes.
So if I were to ask you, how does vancomycin work? What would you tell me?
The micromycin
Yep.
Is killing the formation of the wall, right?
There you go.
Yeah.
That's right.
The
So right. So remember that word inhibits the synthesis of the cell wall. So I want you to kind of remember how they said on the test. Inhibits.
Okay.
Peptidoglycan. Cell wall synthesis. All right. You see that?
Yes.
That is what I want you to think of when you think of the mechanism of action for these, okay?
Okay.
All right. Those are the three that you need to know about. Now, penicillin, right? You see penicillin right here?
Yes.
The structure of penicillin looks like this. So this is the actual chemical structure of penicillin. Looks like a little house, right?
Yes.
This little house, this little thing is called a beta-lactam ring. Okay?
Okay.
So the penicillin is made up of a beta-lactam ring. That's part of the structure of the penicillin that makes the penicillin strong. Okay?
Okay.
So that's going to be important in just a second. Watch this. Hold on, let me go back. Okay. So you have two types of penicillins. What are the two types?
There is the gram-positive.
No. The two types of penicillin.
Okay. BK, potassium, and penicillin G.
Okay. What's the major difference between the two?
The BK, potassium oral, means it can handle the acid of the stomach. Oh, okay.
And Pen G is given how? How do you give Pen G?
Yeah, it's intramuscular or IV, right?
Right.
Vein.
Right.
Okay.
So the key thing here is that you give Pen V or Pen VK by mouth.
Yes, oral.
There you go. And that's because it can handle the acid of the stomach.
Yeah.
Now, if you think about it, like, so we use one penicillin called benzathine, right?
Yes.
Benzathine is typically used for syphilis.
Okay.
And you give that intramuscularly.
Okay.
Okay. So you give, so if someone had syphilis, you basically would give them a penicillin, one shot of penicillin in the muscle, and that would cure the syphilis.
Yeah. Okay.
Okay. Now, let's say, for instance, you gave them a shot of penicillin for syphilis and they had a bad allergic reaction, right?
Okay.
Could you give them another type of penicillin instead?
Yeah.
No.
No?
No.
Because he has if he has a big reaction to allergy, yes, no. No.
Right.
Yeah.
So that means if they're allergic to penicillin,
Yes.
you can't give them another penicillin.
Yes.
That means they're allergic. Does that make sense?
Yes.
Okay, perfect. All right. So what does this say up here, this top part?
Okay. Wide spectrum elements are AMED, up on acid, ampicillin, and amoxicillin, can combine with clavulanic acid, beta-lactamase inhibitor.
Okay, good. So let me tell you what that means, okay?
Yeah.
So basically, you have these wide spectrum penicillins. Ampicillin and amoxicillin are what we call wide spectrum. They can cover a lot of different things, a broad category of things, right?
Yes.
And so you basically combine these things with something called clavulanic acid. Now, clavulanic acid is a beta-lactamase inhibitor. Now, what did I tell you beta-lactamase is? I mean, what did I tell you beta-lactam is?
Is the extractor of the penicillin.
Very good. And whenever you say lactamase, what does the ACE mean?
Is the extractor? No, enzyme. Yeah.
Enzyme. So anytime you see something that ends in ASE, it's an enzyme.
Okay.
So what do you think beta-lactamase does? What does an enzyme do?
Is inhibit the formation of the cell wall of the bacteria.
No. Let me back up. So if I just any enzyme, what is the function of an enzyme? It helps break things down.
Yes. Yeah.
So if you see an enzyme called beta-lactamase, what do you think the beta-lactamase enzyme is going to do?
Will be killing the breaking, because it's an enzyme.
Breaks down what?
The cell walls.
No. Look at what it is. Look at the word. It breaks down what? If it's okay, for instance, let me give you an example. If I say protease, right? If I say protease, that means it's going to break down proteins.
Okay.
Okay. If I say sucrase, that means it's going to break down sucrose. Do you understand that?
Yeah.
If I say beta-lactamase, that means it's going to break down what?
Betas.
What?
Betas. Beta-lactase.
Beta-lactam. What is the beta-lactam?
The beta-lactam is the inhibitor.
Nope.
No.
No. I know where we're at. I know the problem. Okay, watch this. Let's go back. Look here. What is this right here at the top?
Penicillin is the beta structure ring.
That's right. That's right.
Uh-huh.
So penicillin is made up of a beta-lactam ring. That's the structure of penicillin.
Yes.
So what does beta-lactamase do?
Breaks beta-lactams.
So what is it breaking?
It's breaking the I can't understand what, sorry.
No, you got it.
Yeah,
So just think about how we said it. First of all, what is beta-lactam? Where do you find it?
Is the structure, right?
Structure of what?
Of the penicillin.
Good. So what does beta-lactamase do?
Breaks the structure
Of what?
of the penicillin.
Very good. Do you want to break the penicillin?
No.
Good. Right. So look at this. So what is a beta-lactamase inhibitor?
Oh, okay. Yeah, it's something that prevents that the breaking of, right?
Yep.
The structure of the penicillin.
Very good. So the reason that you have that is because some bacteria, right, have gotten very smart. And because they've gotten so smart, they've started making or releasing beta-lactamase. Some bacteria, right?
Okay.
And when they release this beta-lactamase, they are killing the penicillin. So you're using the penicillin, but the bacteria are starting to release some of it, the beta-lactamase, okay?
Okay.
So that's why sometimes if you have amoxicillin, you have to combine amoxicillin with like clavulanic acid.
Okay.
Because if you just give them amoxicillin, sometimes the bacteria may get smart and be resistant to it. Does that make sense?
Yes.
So whenever you do that, you have something called augmentin.
Okay.
You ever heard of augmentin?
Yes.
So augmentin is just amoxicillin combined with the clavulanic acid. Okay?
Yes.
But now you understand the mechanism.
Yes. I know, because they have the beta-lactamase inhibitor.
That's right. Now, the way that we do it, and we like to do it, is to make sure the way we know you understand it is if you can teach it. So what I want you to do now is I want you to teach me what you've learned, and I'm going to be just the narrator. I'm going to go through the slides, okay?
Okay.
And what you're going to do is you're going to teach me, let's see if I can do it this way. I'm going to take this out, okay? I want you to teach me based on the slide what you see and what you're, what we're looking at, okay?
Okay.
Okay, all right. I'm ready.
Okay. Okay. The cell wall inhibitor, right?
Yeah, teach me the slide. I'm you now. You're me and I'm you.
Okay.
And the best way to do it is just start talking about what you remember.
Yeah. Okay. The one that you teach me before, right?
Yeah, just whatever you remember, whatever you remember.
Okay. We have antibiotic that is the most common use is the penicillin.
Okay.
And this is an antibiotic that we can that we use that has a structure. It's similar to a house. It's a structure ring, and the name is beta-lactam ring of the structure of the penicillin. Right? And we have two types of penicillin. One that we can give it by the mouth.
Well, stay on this first slide first.
Okay.
Anything else on this slide I need to know?
Yeah, that the beta-lactam ring of the penicillins breaks the structure and of the bacteria that and if we want to we can add to the cell wall inhibitors to make stronger the penicillin. No.
All right, I see. Okay. So
Okay.
do you see why I have you teach it?
Yeah.
Because that tells me whether or not you truly understand it.
Okay.
So, okay. So you're right. So beta-lactam rings or the penicillin are the structure of the penicillin. I agree.
Okay.
The first thing, the way I would explain this slide is you see the cell wall inhibitors.
Yes.
Cell wall inhibitors is a mechanism. This is the first thing you say. A mechanism of action.
Okay.
For antibiotics. And which antibiotics? The ones that you need to know the most about are vancomycin, cephalosporins, and penicillins. All right. This cell wall is made up of something called a peptidoglycan. So the cell wall itself is a peptidoglycan cell wall. You understand that?
Yes.
Okay. So the way you explain this slide is that penicillin, vancomycin, cephalosporin, all are peptidoglycan cell wall inhibitors. That's how they work. That's their mechanism of action. They inhibit the cell wall synthesis.
Okay.
Okay. And then when you say, okay, penicillin has a beta-lactam ring, which I like that. And that is the structure of penicillin. Very good. All right, now explain this next slide.
Okay. We have two types of penicillin.
Okay.
The BK and the PNG. The difference with both is that the BK we can give it by mouth orally, and the G we can give it intramuscular or IV. You make an example of this that we use for syphilis patients. We can give it just intramuscular to cure the syphilis. But if we have a patient with big allergies to penicillin, we can give it that, right? We have to make give a different kind of antibiotic to try.
Very good. Perfect. That now you did that one wonderfully. That was good. That was really good. Okay. What about this one?
Okay. We have two types of penicillin too. That there is the ampicillin and amoxicillin, and these both we can combine with clavulanic acid, that is a beta-lactamase inhibitor. Why? Because with this beta-lactamase inhibitor, we kill the smart bacteria, because sometimes the bacteria are smart and they create beta-lactamase, right? And then if you give the amoxicillin with acid clavulanic, you kill the bacteria that are producing that, because they have an inhibitor to prevent.
Good.
That
that is beautiful. Great. You did a great job on that. Perfect. Okay. So now let me tell you. Okay, great. So ampicillin. So two things you want to know about ampicillin and amoxicillin. Ampicillin, you can give ampicillin by IV or mouth, but typically ampicillin is given IV. Okay. Amoxicillin is always by mouth, oral. So the MO, we use MO is oral, and MO meaning otitis media. Otitis media is like an ear infection.
Okay.
So amoxicillin is good for abscesses, inner ear infections, things like that. Okay. But again, the key thing to remember here is that ampicillin is typically given IV. You could give it by mouth, but amoxicillin is more by mouth.
By mouth. Okay.
Okay. All right. Now, this slide right here, I use this mnemonic, Don, D-O-N. That's the person's name, right?
Mm-hmm.
Don is skinny. Skinny meaning narrow. All right.
Mm-hmm.
And so if you notice, the last one I talked about were wide spectrum antibiotics that cover a lot of things, right?
Yeah.
Narrow spectrum means that these cover a specific thing, right?
Okay.
So like if you have a staph infection and you want to cover just the staph, then you need something that's narrow.
Okay.
Or do you understand what I mean when I say narrow spectrum?
Yes, it's specific for something.
Something. There you go. You got it. Perfect. Now watch this mnemonic. Don is skinny. He's narrow and not scared to get in the ring. So what this means is Don, D-O-N, has the beta-lactamase inhibitor already in his tool belt.
Okay.
So Don doesn't need clavulanic acid because Don already has
Mhm.
the ability to inhibit beta-lactamase. Do you
Okay.
understand that?
Yes.
Okay, good. So like amoxicillin, ampicillin, they may need a combination drug. Now, let me back up. Most times you give amoxicillin by itself, right?
Yes.
The only time you really will add clavulanic acid is if amoxicillin is not working.
Yes.
And that means that, hey, we may need to add something to it. But for the most part, you start with amoxicillin first, okay? Now, look at DON. DON stands for dicloxacillin,
Okay.
oxacillin, and nafcillin. That's the DON, D-O-N. Those are the DONs, okay?
Okay.
So these are all penicillins, but they do not need any clavulanic acid because they already have a beta-lactamase inhibitor built into their system.
Okay.
So these are called narrow spectrum. You got it?
Okay. Narrow spectrum. Mhm.
Right. All right. And the key thing about narrow spectrum is that you don't need a beta-lactamase inhibitor with them.
Yeah.
Okay.
Yeah.
All right. Now, get in my car to meet IV. Get in my car to meet IV. So these are your IV penicillins.
Okay.
So we know Pen-G, remember that, right?
Yes.
Carbenicillin, that's an IV penicillin, and methicillin.
Mhm.
So that's how you look at that. Meth, the carbenicillin, right?
Mhm.
And the Pen-G.
Okay.
So get in my car to meet IV. All right.
Okay.
All right. Now, you don't have to memorize the orals if you already know your IVs, right?
Yes.
So if I already know which ones are IV, I don't have to memorize. So for instance, if I see cloxacillin, it's not part of my IV, is it?
No, it's not.
So it must be oral.
Mm-hmm.
So that's how you look at that, okay?
Okay.
All right. Now you remember I told you ampicillin could be IV or oral.
Or oral. Yes.
All right, good. All right. Now, this is an important thing. Actually, let me show you something. So one of the big questions on the exam that they will ask you about is something called prophylaxis, right? You probably heard of that.
Mhm.
Like when to prophylax. So if somebody had, like, say, a heart valve replacement, right?
Yes.
How do you prophylax?
Given.
Now, are you familiar with the protocol?
Yeah. Before coming for a clinic,
Yeah.
we have to prevent infection, right? And
Okay.
given prophylactic antibiotic 1 hour before to
Yep.
the practice. Take 2 grams of amoxicillin, and after finish all the procedure, he has to start taking again 2 grams, and after that, special every 6 or every 8 hours, depend.
Perfect. Now, that's great. So now that's true. But here on the test, they'll ask you questions like this.
Okay.
All right, what if they can't take anything by mouth?
Mhm. We have
Then what do you do?
we have to give it IV ampicillin, right?
Very good. Very good. All right. What if they are allergic to penicillin?
Okay. We have to give it, yes, something for allergy, cephalosporin or azithromycin. Yeah, azithromycin, I think is the most common use, right?
So yeah,
Azithromycin.
so you can use cephalexin
Uh-huh.
or any first generation cephalosporin.
Yeah.
Okay.
Okay.
Azithromycin, you could use azithromycin, clarithromycin. It used to be clindamycin,
Yeah.
but we've taken that away because with clindamycin has a bad side effect,
Mm-hmm.
which basically is called pseudomembranous colitis.
Oh.
That's a bad side effect of clindamycin, which you'll learn about. We're going to teach you about that too.
Okay.
All right, good. So that is something that they will ask you on the test, okay?
Okay.
So I would definitely remember that. Now, the next thing is your cephalosporins.
Mm-hmm.
How do cephalosporins work? What's the mechanism of action?
The cephalosporins, the cell walls inhibitors.
Very good. Perfect. Very good. So they work the same way as penicillin. They inhibit the
Yeah.
cell wall, right?
Yes.
Good. Now, guess what? Cephalosporins are like Don. You remember Don?
Yeah. Yeah.
They don't need a beta-lactamase.
Yes, because they have.
They already have it, right? So that's where you have evades beta-lactamase because it already has it.
Yeah.
The P is penicillin alternative to staph. So if somebody's allergic to penicillin, you can give a cephalosporin. You can give a cephalosporin.
Yes.
Now, the H means you can also have hypersensitivity reactions. Same thing like penicillins. If somebody's allergic to a cephalosporin, you can't give them another cephalosporin.
No.
Okay. All right. So that's the key for cephalosporins. Okay.
Okay.
Now, there are more than 4 generations now. They used to only have 2 generations, but now they have at least 5 or 6 different generations. And when I say generations, each generation, the cephalosporin gets stronger.
Okay.
Does that make sense?
Yes. That's the
So the
reason
first generation, do what?
That's the reason there is 4 now, I say.
Yes. So every time you have a new generation, it has more coverage. It can cover more things. So the first generation, I always like to think of the first generation of cephalosporins as the rich girls. These are the girls from Hollywood, California.
Okay.
And their names are Zoe, Roxy, and Lexi.
Okay.
They're 3 sisters, okay?
Okay.
So look at this. Cephazolin, Cephalexin, and Cefdroxil. So that's Zoe, Lexi, and Roxy. You understand that?
Yes.
All right. So those are your first generations. All right.
Yeah.
So the second generation is their mother. All right. So you have the 3 daughters, and now you have the mother who's from Hollywood, California, and she loves her fox fur. She loves very rich, she loves very expensive things like a fox fur coat.
Okay.
But she's afraid of the fox fur. She wants it because it's expensive, but she's afraid of it. Her name is Anna. Okay. So look at this. So see, Ceph fur, that's the fur coat, cephalosporin, and it's a fox fur coat, cefoxitin. You see that?
Okay.
And they are good for who?
Anaerobe. Anna.
Anaerobe. Anna. You got it?
Yeah.
So you remember when we talked about if somebody's allergic to penicillin, you can give a cephalosporin?
Yes.
You typically will either give a first or second generation cephalosporin.
Okay.
So that way now, if they put it on the test, excuse me, you know which one. All right. So any questions on that?
No. No.
Okay. The third generation, I always say the third starts with the letter T, right?
Yes.
And I like to say you have to fix the T, the letter T in the number 3. Fix the T because the T is crooked. So fix, see the fix?
Yes.
You fix the T, you see tri means 3, right?
Yes.
And here's your other T. So in your third generation, you're going to look for fix the T.
Fix the T. Third generation. Okay.
Got it?
Yes.
And then the fourth generation is prime for Pseudomonas, means it's really good for Pseudomonas infections. So we call that Cephalosporin because it's prime for Pseudomonas.
It's prime. Okay.
So, all right, the take-home message from this is one, what they'll ask you on the test is how do cephalosporins work? And you already know that. And they may not ask you about cephalosporin. They may just say, okay, what is the mechanism of action for ceftriaxone? And so since you know ceftriaxone is a cephalosporin, then you know how it works, right?
Yes.
Very good, very good. Do you need a beta-lactamase inhibitor in combination with this?
No.
Very good. If you are allergic to penicillin, can you give this?
Yes.
Very good. You got it. Perfect. All right. You don't need to know that. Okay. Ace-trionam, it is another cell wall inhibitor, but they really don't ask about it. So I'm not sure. I have it here. I don't think you're going to see it, but it is a cell wall inhibitor, but it's used for like gram-negative rods, like Klebsiella.
Okay. Another.
And this PowerPoint is in your calendar. Okay.
Okay.
All right. Now this is important. It's called protein synthesis inhibitors. Now you remember I told you how the way we kill bacteria is what protects the bacteria, right?
Yes.
So one way we can kill the bacteria is by killing the cell wall, right?
Yes.
The other thing is that protein synthesis, all bacteria, in order to live, they need to make proteins.
Yes.
And they make proteins through a structure called ribosomes.
Okay.
So ribosomes, there are 2 ribosomes. Well, so whenever you look at a bacteria, it has a big ribosome and it has a small ribosome. The big ribosome is called 50S.
Okay.
The small ribosome is called 30S. And you can combine these 2 together and it'll give you 70S, right? That's the structure, right? Now, you need these ribosomes because you have this thing called messenger RNA, mRNA. The messenger RNA is important for what we call translation. Translation is what equals protein synthesis.
Okay.
So let me make sure I'm going to recap that for you. So you have this bacteria and it's starting to grow. And in order for this bacteria to get strong, it's going to have to start making proteins. Now, in order for the bacteria to make proteins, it's going to have to use its RNA, its messenger RNA, and it's going to send that messenger RNA to the ribosomes. And it's going to say, hey, I need you to make me some proteins. And you need those 2 ribosomes to help make the proteins. So the bacteria will be strong, right?
Yes.
Well, we don't want that to happen. So we're going to give an antibiotic that can inhibit the ribosomes.
Okay.
So we use this mnemonic that says we buy at 30 and sell at 50. Let me tell you what that means. Think about it like the stock market, okay? The stock market.
Okay.
If you are buying stock, do you want to buy the stock cheap or expensive?
Cheap.
You want to buy it cheap and you want to sell it expensive, right?
Yes.
So look at what we did. We bought it at $30 and we sell it at $50.
Okay.
So that's the mnemonic. Buy at 30, sell at 50. Now the AT means aminoglycosides.
Okay.
That's the A. The T is tetracycline. You got that?
Yes.
All right. So if I were to ask you, how does tetracycline work? What would you tell me? What's the mechanism of action for tetracycline?
It's an inhibitor of the protein synthesis of the ribosomes. It's an inhibitor
Which ribosome?
of the 30, the small one.
There you go. Perfect. That's beautiful. Perfect. Now, then the cell at 50 is chloramphenicol, clindamycin. That's your C's, right?
Okay.
Erythromycin is the E. And then linezolid or lincomycin is the L. Okay?
Okay.
Okay. So those work by blocking or inhibiting the 50S.
Yes.
That makes sense?
Yes.
All right. Perfect. 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 Now, all of these are bacteriostatic, meaning that they can slow the growth of the bacteria, right? That means static.
Mm-hmm.
But aminoglycosides are bactericidal. They're going to kill the bacteria.
Okay.
All right. The others will stop it from growing, but the aminoglycosides are going to kill it.
Okay.
All right. Got it?
Yeah.
Okay. Now watch this. So here's what we just looked at, the 30S, right?
Yes.
So we said the AT, A is aminoglycosides,
Mhm.
and you see the red MNO, amino. So MNO, side effects. It can cause muscle weakness. That's one of the side effects of aminoglycosides. Nephrotoxic, that's a side effect. It means it can affect the kidney. Ototoxic means it can affect hearing. So those are side effects of aminoglycosides, okay? Now, this is important. In pharmacology, you always want to look at the ending of the word because that can tell you a lot about what the word, which antibiotic it is or which drug it is. So typically aminoglycosides end with mycin or mycin like this. So you can have gentamicin, right?
Mm-hmm.
You can have streptomycin, right?
Okay.
Okay. So typically, if you see mycin, MICIN or MYCIN, it's an aminoglycoside. You got it?
Yes.
However, there are 3 mycins that are not aminoglycosides. They are called macrolides.
Okay.
So let me show you that. So before I go, okay. So you see right here where it says macrolides?
Yes.
Macrolides work at the 50S ribosomal subunit. Okay.
Okay.
Now, those 3 have the mnemonic ACE, ACE,
Mm-hmm.
azithromycin, clarithromycin, and erythromycin. You see the ACE?
Yes.
Even though they end in mycin, remember I told you, if it's mycin, it's typically an aminoglycoside, right?
Yeah.
But these 3 are macrolides.
Okay.
Okay, you got that?
Yes.
All right, perfect. So if I asked you, what is the mechanism of action for gentamicin? What would you tell me?
Gentamicin is an inhibitor of the ribosome 30S.
Perfect. You got it. And then if you say, okay, what's the mechanism of erythromycin?
Erythromycin is part of the macrolide, and then it's an inhibitor of the ribosome 50S.
Perfect. Beautiful. Perfect. Perfect. So you see this word macrolides, right?
Yes.
So macrolides, this macro is the mnemonic. Those are some of the side effects of the macrolides, right? Motility issues, problems walking, moving, arrhythmias, right? They can have heart arrhythmias, right? They can have problems with the liver, cholestatic hepatitis. They can develop a rash or even eosinophilia. So that's the macrolides, okay? Now, going back to the 30S. So we know aminoglycosides, in with mycin, and the T was for tetracycline. You will surely have a question about these on the test, okay? The key thing for tetracycline is what's the major side effect of tetracycline that you know about?
Is the coloration that cause permanent stains on the dentition, you know.
There you go.
Yeah.
Perfect. Very good. So with the side effects, you can have the tooth discoloration, you can have photosensitivity reaction, right? So people who are taking tetracyclines have to kind of stay out of the sun, things like that, right?
Yes.
It can also, basically, you can get Candida only because of the immunocompromise. So if it lowers the immune reaction or lowers the immune system, that makes you more susceptible to fungal infections. Okay?
Okay.
Now look at this mnemonic. Don't give to those less than 8 and women overweight. Let me tell you what this means. Less than 8 and women overweight. So less than 8 meaning basically children, right?
Mm-hmm.
Overweight, we're talking about, okay, somebody who's pregnant.
Okay.
So you don't give it to pregnant women and you don't give it to children, right?
Yes.
Pregnant women, you don't give it to them because it is considered, we use this word called teratogenic. You ever heard of that?
Yeah.
What does that mean, teratogenic?
Cause problems with the babies.
Correct. Very good. That's right. It can affect the fetus. Perfect.
Yes.
So tetracycline you don't want to give because it is teratogenic, and tetracycline can, get down, affect the bone and things like that. So if you think about it, you really don't use tetracycline for a lot of different things. Okay. Like if somebody had like rickets, which is called, it's a thing called rickettsia, Rocky Mounted Spotted Fever. Rickettsia, you could use it for that. Chlamydia, to shrink perio pockets. But again, they will tell you more about the tetracycline when you do perio.
Okay.
Okay.
Mm-hmm.
All right. So we know the 30S, how they work. Now we get to the 50S. So clindamycin is one you want to remember for the test. Clindamycin is good against anaerobes. But the problem with clindamycin, this is very important, is that someone who's on clindamycin can develop something called C. difficile. The C stands for Clostridium. Okay? So clindamycin can cause someone to develop Clostridium difficile, which basically would lead to pseudomembranous colitis. That is important, which basically looks like a bloody diarrhea.
Okay.
All right.
Uh-huh.
All right. That is one they love to ask about. So clindamycin, you understand that?
Yes.
Okay, good. The next one, the other C is chloramphenicol. So always when I see chlora, I think of chlorine, right?
Mm-hmm.
Now this is not true, but in a swimming pool, there is chlorine. Okay. And so if somebody fell into like a baby fell into a swimming pool with chlorine, the baby would turn gray. That's not true, but it's the way to remember this chloramphenicol. So always say chloramphenicol, remember gray baby syndrome.
Okay.
That's one of the side effects of chloramphenicol. Kind of gives that gray baby syndrome. The mnemonic is BAG. So it can cause bone marrow problems and aplastic anemia and gray baby syndrome. That's the mnemonic for the side effects of chloramphenicol.
Okay.
So again, think about it. So now you know how chloramphenicol works.
Yes.
Macrolides we've discussed.
Mm-hmm.
Okay. Now, TB, you've heard of TB, right? Tuberculosis.
Yes.
Do you know how you test for TB? How does someone test for TB?
Yeah, they take an example of the how I say the I know the word in Spanish, but I don't know how to describe
Okay.
it.
Tell me what happens. Tell me how they do it.
The sput, or the flames that we have.
Yeah.
They take an example of that and make a lab test. If they have the TB virus. I don't know.
Okay. So we use something called a PPD test.
Okay.
A PPD test is basically you take a little bit of the tuberculosis or tuberculin and you inject that under the skin.
Oh.
Okay.
Okay.
And then you come back in about 48 hours and you go back to the doctor and you let the doctors look at it to see if there's any redness, if it's raised, if there's a big circle. You look at that to see if it's a positive PPD test.
Okay.
Okay. Mm-hmm. If the test is positive, that doesn't mean you have TB. It just means you've been exposed to TB.
Okay.
So then you have to go and get a chest x-ray.
Mm-hmm.
And the chest x-ray will, if the chest x-ray is positive, then that means you have TB.
Okay.
Do you understand that?
Yes.
Okay. All right. Key things. Okay. So the way you test for TB is a PPD test.
Mm-hmm.
And then you wait 48 hours to see if it is positive.
Mm-hmm.
If it is not positive, you don't worry about it. If it is positive, then you get a chest x-ray to confirm it.
Okay.
If the chest x-ray says it's positive, then you need to start TB drugs. Okay?
Okay.
The TB drug that you're going to start is isoniazid, called INH. Okay?
Mm-hmm.
Now, this one, if you give somebody this drug, it lowers their vitamin B6 levels. It decreases, INH decreases B6.
Okay.
So that means if they're taking that drug, they're going to have to also take the vitamin B6.
Mm-hmm.
And this drug can affect the liver. So they're going to have to, while they're taking the drug, make sure they're getting regularly scheduled liver tests, blood samples for the liver to make sure the liver is functioning fine.
Okay.
All right. Now, tuberculosis affects the lungs, right?
Yes.
The lungs are part of your respiration, right?
Yes.
So the mnemonic that we use to remember the TB drugs is called RESPI, respiration.
Okay.
So the R is rifampin. Okay.
Okay.
The E is ethambutol. The S is streptomycin. P is pyrazinamide, and then the I is isoniazid. So that's the RESPI. Okay.
Okay.
Now, the ones they would ask you or want you to know about on the test is the rifampin and isoniazid for sure. Those two for sure.
Okay.
Okay.
Mm-hmm.
Now, the thing that they ask about with rifampin is the side effect of rifampin is that it revs up or speeds up. Revs up means speeds up, or we use the word induces the P450 of the liver.
Okay.
Okay. So the P450 system of the liver is your metabolic pathway. So your liver is like a big metabolism, a big metabolic machine, right?
Yes.
And the P450 are the enzymes that run that machine.
Okay.
So rifampin will speed up the machine. Does that make sense?
No.
Okay. All right. Gotcha.
Yeah.
All right.
No.
So think of it this way. So I want you to visualize your liver. Can you see the liver?
Yeah.
All right. Here's that liver, right? Here's the liver.
Mm-hmm.
Now, in the liver are these enzymes. That's the enzymes.
Mm-hmm.
You see those enzymes?
Yes.
These enzymes together make up the P450.
Okay.
Those enzymes will help to metabolize things that come through the liver, like other drugs. So I'll give you an example. So there's a drug called warfarin, right?
Mhm.
Also known as Coumadin. Do you know what warfarin does?
Yeah, it's for anticoagulate. It's
Very
an
good.
anticoagulant. Uh-huh.
Perfect. Very good. So warfarin is metabolized in the liver. So if somebody's taking warfarin, it's going to be broken down in the liver. Okay.
Okay.
Now it's broken down through the P450 system. That's the enzymes for metabolism.
Mm-hmm.
Now rifampin, you see rifampin right here.
Yes.
It's going to speed up the P450.
Okay.
So that means that warfarin is going to break down faster, and it's not going to stay in the body as long
Of course.
because you're going to get rid of it faster. That means if you get rid of it faster, warfarin is not going to be working as well.
Mm-hmm.
So that means the person will be more, may have the more tendency to clot.
Mm-hmm.
All right.
Yeah.
So that's what I mean when I say rifampin revs up or speeds up the P450.
Okay. Yeah.
You understand that?
Yes.
The side effect of rifampin is that it can turn your urine red or orange.
Okay.
So that's one of the side effects.
Okay.
Okay. All right. So, and the other way, if they say, well, how does rifampin work? You see that R? It works by inhibiting RNA polymerase.
Okay.
So it's an RNA polymerase inhibitor.
Mm-hmm.
So you see, so rifampin, just remember the R's.
Ours. Yes.
Okay. You see the ethambutol?
Yeah.
The only thing you need to remember is that the side effect is eyes. It can affect the eyes.
Okay.
We don't use streptomycin. They're not going to probably put that on the test. That's not going to be used. But you already know how streptomycin works.
Yes.
How does streptomycin work?
The streptomycin is sorry.
Take your time.
Yeah. The streptomycin is the antibiotic that is for the ribosomes. What's 50s?
Think about that. Now you remember 50S.
Yeah.
So you remember 30S.
Yeah. Sorry. Yeah. I was on the doubt that it's 30, but it's for the 30s. Right?
That's right.
Yes.
That's right. Because the 50S were your macrolides.
Macrolides. Yes.
And what are your 3 macrolides?
The 3 macrolides are azithromycin.
Yeah.
What was more? Okay. Azithromycin, erythromycin,
Uh-huh.
and
Clindamycin.
No. What was the other one?
Yeah, you said clindamycin.
Clindamycin. Yeah.
Right. And you remember the mnemonic was ACE.
Yes.
Okay, perfect.
Azithromycin, clindamycin, and erythromycin. Yeah.
Very good. Okay. Can you answer this question?